How to recognize patients with thalassemia? Thalassemia clinically is divided into thalassemia minor, intermediate, and thalassemia major. Thalassemia major is also known as transfusion-dependent thalassemia, since all patients need regular blood transfusion, while thalassemia intermediate is classified into transfusion-dependent thalassemia or non-transfusion-dependent thalassemia, depends on the severity of their hemoglobin level. Thalassemia minor clinically asymptomatic. Most of them were diagnosed to have thalassemia when found to have abnormal full blood count during routine medical checkup. Some of them might have mild anemia. Thalassemia intermediate usually presented with anemia at age of 2 years or more. Example of thalassemia intermediate is hemoglobin E compound with heterozygous beta gene abnormalities. While thalassemia major, they presented very early in life. For patients with 4 deletional alpha thalassemia, most of the time they are not compatible with life. While thalassemia major, due to homozygous or compound heterozygous beta gene abnormalities, they presented with severe anemia at age of 6 months. Thalassemia major patients need regular blood transfusion between 3 to 6 weekly, while thalassemia intermediate depends on their hemoglobin level. Some might need quite regular blood transfusion, some might not need any blood transfusion. The hemoglobin of a patient with symptomatic thalassemia is not adequately maintained, they will develop complications such as severe anemia, jaundice, hepatomegaly, splenomegaly, stunted in growth. Other complications such as frontal bossing, prominent maxilla, and zygoma also can develop due to severe anemia. They also might have a poorly developed or underdeveloped secondary sexual character. Typical radiological finding known as crew-cut appearance might occur due to extramedullary hematopoiesis in the skull. Thank you.